Yes, good morning, everyone. Thank you. Thank God it's Thursday. So I would like to now, this is our second presentation for the healthcare tax credit. Of course, you have to be ready to apply for the 2021 coverage. Before I proceed to our guest speaker for today, let me just go over on our company. I'm Christopher. I'm the CEO of Wyco Tax, an all year round, all in one tax payroll bookkeeping service solution. We are processing more than 7.5 million of tax refunds. We also do the audit, the IDL, PPP, and right now we're doing the PPP loan forgiveness. As early as now, we are giving free consultation for your year-end tax payroll and bookkeeping reports. So if you have more questions, feel free to keep in touch with us. Then our webinar, this will only last for 30 minutes. The participants are encouraged to type your questions on the box, either on Facebook Live or here on Zoom. But if you will miss the presentation, feel free to follow us on YouTube, Wyco Tax. You would see the replay of the presentation. Just go ahead and visit our website. Then you would be able to download a pre-copy of a PDF. Any topics, comments, or suggestions, just text us on our number 956-425-WICO. Again, it's 956-425-WICO. Here you would see our YouTube. If you would like to get in touch with the CEO with me personally, go to my LinkedIn profile. Just a disclaimer that this material has been prepared for informational purposes only. It is not intended to provide and should not be relied on for tax, legal, or accounting advice. Examples of and other materials in this webinar are only for illustrative purpose and should not be relied for any technical answers. Wyco Tax is an outsourced tax payroll and bookkeeping company, and it's not associated with any institutions on this presentation and is a private business providing resources for small businesses. Let's jump over with our healthcare tax credit. I am proud to announce that our guest speaker is well experienced in terms of the health insurance for the Affordable Care Act, certified as a health insurance agent, and he's also my financial advisor to all my individual and business accounts. No other than we have Mr. Lee Guerra. Mr. Lee, good morning. Raymond, please give the remote to Mr. Lee.
Good morning.
There
Good
you
morning, everyone. We will be talking about the open enrollment 2021. It started November 1st and will end December 31st. So if you qualify for a subsidized plan, your cost for the health insurance premium will be reduced. Do I have to get health insurance through the marketplace? The marketplace doesn't list or offer these plans. The only way you can enroll in health is through the marketplace. And also you can enroll outside of the marketplace, but the only way you can get the health credit is through health insurance marketplace or affiliated companies that will tie you back to the marketplace to get your credit. Also, you can enroll outside of the enrollment period, and you may qualify for a special enrollment period. Is health insurance required for 2021? Well, starting with the 2019 plans, the individual shared responsibility payment is no longer required. So the answer is no, you don't have to enroll. However, you won't have any health insurance. And especially right now with COVID, it's so important for you to have health coverage. Some states offer their own individual health mandates, requiring you to have a qualified health insurance plan or pay a fee. But as far as in Texas, we are not required. We follow under the federal guidelines. I'm going to talk about the advanced premium tax credit, or as Christopher called it, health insurance tax credit. It's a tax credit that can lower your monthly insurance. It's usually called a premium. when you enroll in a plan through the health insurance marketplace. Your health credit is based on income estimates and household information you put on your application. And of course, I can assist you with that. It is estimated, it estimates your income, which if you fall between 100 and 400% of the federal poverty level for your household size for you to qualify for this credit. If your estimated income falls between those guidelines, then definitely you will be awarded a credit, providing that all the other qualifying requirements are met. You can use all, some, or none of the premium credit at the time to reduce your monthly payment. If you use more advanced payment of the tax credit than you qualify for it at the end of the year, you must repay it when you file your federal income tax. If you use less credit than you qualify for, then at the end of the year, when you do your credit, your taxes, you will be given a refund. You can buy health insurance through other sources, but the only way to get the premium tax credit is through the health insurance marketplace. This chart illustrates for 2020 what the estimated income requirements are for household size. So I'm just going to touch on a few of them. So if you're single and you file your taxes single, you would have to make a minimum of $12,490 in order to qualify for a credit. Now, of course, you can make more than that. There are guidelines as far as what the maximum allowable income is in order for you to qualify for a credit. But let me also take an example of a household of, say, 4 people. So that would be the mother, the father, and then the children. So that would be 4 people. So the minimum income for that credit would be $25,750 as the minimum income. So of course, you can make more. The more you make, the less tax credit you get, but there is a cap. So after the presentation, we'll talk more in detail about the individual tax credit. Here, I'm going to shift for a few minutes these are for small businesses that are on the call. If you have a small business and you want to cover your employees, the Federal Exchange has a program called SHOP, Small Business Health Options Program. Well, what is this? This is a health insurance for employees of businesses for nonprofit organizations, and you must meet 4 qualifications. First, your company size must be anywhere between 1 and 15 full-time equivalent employees. On the website, or I can help you calculate, there's also if you qualify. To qualify for the SHOP, you must have at least 1 full-time equivalent employee other than the owner, spouse, and family members or partners to qualify. You offer coverage to all full-time employees, generally workers averaging 30 or more hours per week. You don't have to offer it to your part-time employees, those who average less than 30 hours, or seasonal employees. However, if you wish to do so, you can cover your part-time employees. Number 3, the enrollment must be at least 70% of the employees that you offer the insurance to. Now, there are some exceptions. Employees with other health coverage aren't counted as in the mix. So for instance, say you have employees that are getting their health coverage through their spouse, those employees do not count for the 70%. And also on the website, there is a minimum, there is a calculator that helps you calculate that. Some states offer different minimum requirements. If you don't meet the minimum participation, then you can also enroll without meeting the minimum participation November 15th through December 15th of every year. And again, I can assist you with that calculation. And number 4, have an office or employees work site within the state where you offer the SHOP program. And along with the SHOP program, you must also pay a minimum of 50% of the premium cost for the employee and there's also a tax credit that's involved for the company. With that, this is my information. I'm Lee Guerra. I'm also a registered representative. I'm a ACA certified health insurance agent, and I can be reached at lee.e.guerra@mwarep.org. And my business phone number is area code 956-564-9048. So with that, we're going to open it for some questions, and I'll be glad to answer.
All
Christopher?
right. Thank you, Mr. Lee. There you go. Let me just. Okay, so how's the status of the open enrollment? Have you been?
Yes, that's a really good question, Christopher. I've been extremely busy. Right now, I'm enrolling all my clients that I had last year, so I'm just calling them up and re-enrolling them, making any adjustments to their income, their household size. So I'm glad to report all of my clients continue to qualify for the tax credit.
And then you all are doing this an open enrollment online, right?
That's correct. I can do it on the computer on Zoom. That way, both you and I can go through the application process. I can help you. I can help you apply. Or if you don't have access to a computer, we can do it all on the phone. And then you just share the information with me, and I'll put it on your health insurance application through the marketplace. Just remember, everything is secure, everything is confidential, and all your information is kept private. And it's only used for the purpose of applying for the tax credit.
Yes, and most of your clients are individual, or you also have business.
I have businesses that offer the individual credit where they don't have to pay anything, but offer it as a service because it's important for your employees to be covered through health insurance. This way you have healthy employees and they reduce their out-of-pocket expense when they go to the doctor, or if they have to visit the hospital, they're covered. Also, during COVID, all of the plans covered the COVID testing with no cost to to the patient. And then, of course, if you have to be hospitalized, the health insurance covers depending on the plan that you pick. Also, I do want to mention that under the Affordable Care Act, there are 10 essential health benefits that are required under a qualified health plan. And that's like yearly physical at no cost, certain preventive health testing depending on your age that are considered preventive, and those are covered. You don't even have to meet the deductible. So it's the qualified health. I'm going to spend a few minutes talking about a qualified health plan and a non-qualified health plan. A qualified health plan is what we're talking about right now. It has no limit as far as the expense that the insurance company will pay in the event you become ill. The other thing is pre-existing conditions. They're all accepted, so you don't have to worry about, well, I have diabetes or I've had cancer. Under a qualified health plan, if you enroll during the enrollment period or in a special enrollment period, there are no medical questions. So a non-qualified health plan that is available also in the market don't have those benefits. So be careful if you're purchasing other coverage that is not a qualified health plan, that you understand that some of those, that it might not have some of the benefits that a qualified health insurance plan will have.
Right, Mr. Lee, that's a good point. Where do the Affordable Care Act or this insurance stands in terms of the COVID-19?
Well, like I said earlier, it covers the testing.
Mm-hmm.
All the health insurance companies, and I'm going to specifically talk about the Rio Grande Valley now. I am licensed throughout the state of Texas, so no matter if you're listening to this program anywhere in Texas, I can assist you in enrolling in health insurance. But here in the Rio Grande Valley, there's 3 companies that offer the coverage under the Affordable Care Act. That is Blue Cross and Blue Shield of Texas, that is Molina Healthcare, and a company called Ambev.
Mm-hmm.
And again, they have waived the deductibles because some of these plans have high deductibles depending on the plan that you pick and on your budget. All the plans have waived the cost of the COVID testing. So that's another good benefit that maybe a non-qualified health plan will not cover. So that's where we stand. And then also Some of y'all might be wondering about the federal lawsuit that's pending that is going to go this month in front of the Supreme Court about eliminating the Affordable Care Act. We don't know where that stands, but you can rest assured that if you sign up for health coverage during the open enrollment period or as a special enrollment period after the period is over, 2021 will be covered. So don't worry about your coverage not being in effect. If the ruling comes negative, if the ruling stays in place the way it is, then nothing changes. And they continue to make changes to make it a little bit more affordable. So there are very good plans in the marketplace.
And how long does the Affordable Care Act last? And it's is it only until 2021 or?
Well, it lasts unless the Supreme Court strikes it down as unconstitutional. So
Oh,
if that happens, then the Congress will have to legislate what type of health coverage will be available for the general public, if any. Now, what a lot of people don't understand is that the Affordable Care Act also affects large company businesses, like big companies like Coca-Cola, IBM, and so the whole thing, it's not just the individual coverage that you apply for. So there's other requirements that those companies have to meet for their employees. So all that is in question. And the two biggest things that I think the average American is concerned about, and that is pre-existing conditions that they can, prior to the Affordable Care Act, if you had diabetes or if you had cancer, the insurance companies could reject your application, just like life insurance. Some people can't get life insurance because of their health. So prior to the Affordable Care Act, pre-existing conditions were not covered. So sometimes you could get insurance, but they wouldn't cover your cancer. They wouldn't cover a certain pre-existing condition that existed. Under the Affordable Care Act, all that went away and it's covered. The other big one is for your children. Under the Affordable Care Act, your children can stay on your health plan up until age 26. So those are the
mhm.
two main things that affect the average American about getting coverage. Also, if you're in this country legally with documents, then you also can get affordable health care through the Affordable Care Act.
Oh, until 26. So it means to say their income would really, the dependent's income would really affect the type of coverage because the W-2 or whatever source of income they have will be added on the application.
That's right. When we calculate the assistance or what's called the advanced premium tax credit, it includes all the income, taxable income that is coming in the household. So when you do the application, it asks you, how many how many dependents do you have, and do they have income? If they have income, we need to list the income. So all that will determine how much credit you get to help buy affordable health insurance.
Okay, all right, that sounds good. Now, thank you guys for watching and listening to our Affordable Care Act for the healthcare tax credit. We would like you to take advantage of this webinar and get inquiries to our guest speaker and expert, Mr. Lee Guerra. We provided the information on this presentation. If you have more questions, feel free to reach out with us. And tax season is on the air. This is the best time to prepare. Therefore, thank you, Mr. Ligera, because here in Waiko Tax, your success is our business.
Thank you, Christopher. Appreciate the service you provide for your clients and for the for the citizens at large. We appreciate you. Thank you.
All right, stay safe, guys. Have a good
Bye bye.
day. Thank you, Mr. Lee.
Bye bye.
Bye.